Hi everyone, welcome back. So today's topic is compartment syndrome, or mainly focusing on chronic exertional compartment syndrome. That basically means compartment syndrome that is brought on by sort of overuse in exercise, as opposed to that's brought on by trauma or surgery. As with most of my posts, I will talk about basically what it is, what causes it, what the symptoms are, and how you can treat it. Basically, compartment syndrome occurs when injury causes increased pressure and swelling within a muscle compartment of the leg or the arm, as a result of bleeding into that muscle, due to the injury. Now, as I say, this can be like an acute injury, like a trauma, or it can be a chronic sort of overuse injury, which is what we're going to focus on today, although a lot of the details will be the same for both. Compartments within the legs and arms. If we look at this diagram, so it's cross-section of the leg. So you've got these compartments within the legs and also the arm, and they are separated by thick fibrous tissue or connective tissue, which doesn't basically stretch, to allow for swelling and inflammation. And this connective tissue or fascia, it will surround all the muscles. So you can see the different muscles in the legs. You've got the two bones of the leg, and then you've also got nerves and blood vessels running through as well. And the fascia surrounds, all of these structures. So basically, when you end up with an injury, you get inflammation. The leg or arm will swell up, and this then causes increased pressure, which will, compress the blood vessels, reducing the blood supply, and therefore, that sort of capacity to heal the tissues through the oxygen and nutrients that comes in the blood. And the increased pressure can also actually damage the nerves. So, as we said, compartment syndrome, it can occur due to an acute injury, such as maybe a fracture, or that chronic overuse type injury brought on through, exertion, usually during exercise. Quite often runners may find that this can be an issue. So this chronic sort of overuse induced compartment syndrome is known, as I say, as CECS, or chronic exertional compartment syndrome. Now, while acute compartment syndrome is treated with surgery, chronic cases don't usually require this. It's just a matter of following some simple treatment options, and it will usually, just sort of subside. So what causes compartment syndrome? So the causes aren't completely understood, but there have been some suggested causes, and those include muscle expansion during exercise. So in this chronic exertional compartment syndrome, that fascia that we talked about, which surrounds the muscle and all those soft tissues, it doesn't expand with the muscle. So you've got an expanding muscle, but still this tight connective tissue around it. So that causes increased pressure and pain in that sort of muscle compartment of the affected limb. Now, when the pressure within a compartment becomes too high, the blood supply to the muscles and nerves will reduce because there'll be compression on those blood vessels. And so then what happens is that oxygen and nutrient supply to the tissues also becomes reduced because you've got, the circulation has decreased. So in cases of chronic exertional compartment syndrome, these are usually resolved just by stopping the exercise. But if the condition isn't recognised and treated, then the muscle tissue can potentially, atrophy, die, develop increased scar tissue, which is then going to cause you problems with pain and increased injury risk. And also sort of a lot of contraction of the muscle tissue. And also damaged nerve cells may also cause numbness and weakness. So also another cause could be just the way that you move while exercising. And, I'm always saying, with any type of exercise, make sure that you get your technique right before you sort of increase the intensity or duration or whatever it may be. If your muscles, for whatever reason, tend to expand excessively during exercise, or having maybe particularly inflexible fascia around those muscles, for whatever reason, or having high pressure within your veins can also contribute to developing this. So the people that are most at risk, it's usually more common in athletes under the age of 30. Types of exercise that commonly see this problem, certainly running, also cycling and swimming, anything where there is a sort of a repetitive impact on that limb. But also overtraining, if the intensity or frequency of workouts is too high, or if you've got some sort of imbalance in the muscle, that will then put higher impact on other areas and consequently increase the risk of injury and inflammation, which will then compress, those compartments. If you're immobile for a long time, maybe, due to an injury or illness or something, possibly then you're going to get compression of blood vessels due to muscle damage. Other people that are going to be at risk, anyone who, gym goers who use anabolic steroids, and this is where we go back to sort of excessive sort of growth of the muscle when you're doing exercise. That's going to be common in those of you that are very naughty and use anabolic steroids. But also anyone who is on anticoagulant therapy, so things like your warfarin, you're going to have a high risk for bleeding into a compartment in the limb, whether that be spontaneous bleeding, because your sort of coagulation is uncontrolled, or whether it be, following an injury, you're more prone to increased pressure through bleeding. So once you develop this, symptoms, you're going to get like an aching, burning, or cramping pain. Usually you'll feel that it's in a specific compartment of the limb. That's going to bring with it tightness because of that increased pressure. You may get numbness or tingling, certainly if there's nerve damage, you're going to get that. Overall weakness of the limb and decreased range of motion. Potentially in severe cases in the legs, you may even get foot drop. Often you'll find that the same compartment in both legs will be affected. We know obviously there's going to be swelling, and that may occur due to a sort of muscle hernia. But also with that increased pressure and tightness, the skin is gonna possibly become quite tense and take on a bit of a shiny appearance, and maybe a sort of a bruised feeling to it. But with regards to the pain, it tends to be consistent after a certain time or distance or intensity of exercise, and will probably seem out of proportion to the injury, and it can come on following minimal range of motion, but it will get progressively worse as you exercise. So the best thing you can do is, if it comes on, is to just stop what you're doing and rest the limb. Obviously elevate it, maybe a bit of ice just to reduce the inflammation. And you'll find that the pain tends to reduce or stop completely, usually after about 15 minutes of stopping the exercise. So, if you catch it when it happens, then you can usually manage it quite effectively. Recovery time after exercise, though, may increase over time. But if you are finding that the condition is becoming more acute, then we have what's known as the 5 Ps to watch out for. So that's pain, pale skin, no pulse in the limb, paresthesias, which is numbness or tingling in the arm or leg, which again indicates nerve damage or compression, and paralysis, so inability to move the arm or leg. So when you are getting these things, you really need to seek medical attention, and potentially look at different treatment options, which could even sort of extend to surgery. In terms of complications, as I say, if you can sort of become aware of the symptoms and stop exercise as soon as you notice those, the pain, and usually your muscles will recover pretty quickly, and it won't usually cause lasting damage or anything like that, as long as you can sort of treat it pretty quickly. But obviously the pain and weakness, potential numbness that are associated with compartment syndrome may prevent you from exercising with the same intensity or frequency. So it may just mean that you have to make a few adjustments to your workout routine. Complications are rare, but in severe cases, which tends to be in acute compartment syndrome, where you've had a fracture or some sort of traumatic injury, you may find that muscle scarring, contracture, or loss of function of the limb infection, in really severe cases, the need for amputation, but that is rare. Permanent nerve damage, or even rhabdomyolysis, which is basically breakdown of the muscle tissue. And even kidney damage can all occur as a result of compartment syndrome. But with regards to the chronic compartment syndrome, these complications pretty much never happen. And it usually requires no treatment or surgery. It's just being sensible and stopping the exercise and just resting the limb, as you would, with any injury. In terms of treatment, as I say, the chronic compartment syndrome rarely requires any treatment because the symptoms usually stop, around 15 minutes after stopping the exercise. But, if the pain is a problem, standard kind of sports therapy treatment, ice to an elevation to reduce the inflammation. And certainly following an acute injury, you would want to be doing this. If, over time, if chronic compartment syndrome becomes very restrictive, or, obviously in cases of acute compartment syndrome, surgery then can become an option. For the acute compartment syndrome, actually surgery is really the only option, where it basically involves fasciotomy, where the muscle compartment is opened, and that tight fascia, that connective tissue that surrounds the muscles, will be cut to basically release some of that pressure within that compartment. And consequently then, when that pressure is reduced, you're going to restore the blood flow, which means that all those tissues are going to be getting, good oxygen supply again, supply of nutrients, which will promote the healing process. And as I say, with regards to exercise, common sense, maybe just identifying when it's becoming an issue and either doing a lower impact exercise, reducing the frequency or the intensity, or just adjusting it in some way, or stopping, for a period of time, just to help sort of the limb recover. But as with most injuries, prevention is the best treatment. So you can help prevent developing this issue by avoiding particularly strenuous workouts. And so by doing that, you're going to prevent excessive swelling within the muscles. And even more so, this applies, in extreme heat. Stretching regularly before and after exercise. And you may have seen, I've done videos on here about the different types of stretching and when they are appropriate. And also self-massage, or, if you do regular sports in particular, coming and seeing someone like myself, having a sports massage, even just once a month, or if you feel symptoms starting to develop, get in there for a sports massage, and that will really help. And so talking about massage, I'm going to talk briefly about how massage can help with chronic exertional compartment syndrome. So probably the best forms of massage are myofascial release and trigger point therapy, which again will work. They're particularly beneficial. They will help sort of where that fascia becomes really tight. And trigger point therapy also, if there's scar tissue, can be really beneficial. Massage can temporarily, ease the pain. And even by working the lower back, the glutes, and the thighs, will sort of help reduce overcompensation in these muscle groups. If there's an issue in the calf with compartment syndrome, the first thing that's going to happen if there's a weakness there is, probably your thighs and your glutes are going to overcompensate. So by working on those areas and just maintaining the strength and flexibility of those muscles will also help. And passive stretching, which is quite often done as part of a sports therapy treatment, will again help to elongate, particularly short or thick muscles or fascia. And if there are problems with scar tissue or adhesions, using a cross-fibre treatment again can help reduce any adhesions that will also promote that sort of tightness and increased pressure. So yeah, but definitely sort of sports type massage is the way to go, and trigger point therapy. Swedish massage, not really going to do much for an issue like compartment syndrome. So that is pretty much it for this topic. As always, feel free to ask me anything. You can either comment down below, contact me through Facebook or Instagram. I will answer. Feel free to subscribe to my channel. There will be obviously I've done a lot of posts on sort of mental health and physical health issues and pregnancy, but there will be more sports related and specific posts about specific muscle groups coming your way. So feel free to subscribe and you'll be notified when they come out. But for now, that is all from me. So I will see you next time. Since we've been talking about fascia, just keep an eye out. There will be a post coming about fascial dysfunction. So that may be another good one, to sort of go alongside the information I've given you today. But for now, that's it from me. So take care and I'll see you next time.